We've already reached out to her, so hopefully she'll be jumping in really quickly. Good afternoon, and I want to thank everybody for joining us on this Friday afternoon. Thank you so much for giving us your time. I'm Gerald Mitchell. I'm the president and CEO of the Greater Columbus Chamber of Commerce. And we wanted to bring this Health Connect to you today to talk a little bit about COVID-19 and the vaccine as we're in the period or the time frame as so many of us are curious about how we can get in line or get in queue for the vaccine, what the vaccine means for us, and get our community as far down the road economically as we can, and from a health standpoint, get ourselves down the road as much as we can. But with that in mind, we have set up a very, very experienced panel of individuals to speak to you all today. We've got Ryan Loke, Governor Kemp's health policy advisor, who's managing the COVID response for the state of Georgia. We have the Honorable Mayor Skip Henderson, who's a fantastic partner for the Chamber of Commerce and leader for our community. We've got Scott Hill, leader and Chief Executive Officer of Piedmont Columbus Regional, and we will have joining us shortly Melody Trimble, the CEO of Emory St. Francis Health System here in Columbus as well. Before we move on, I want to thank our pandemic partners. So many of you have been very supportive during the pandemic with sponsorship support and other support. And those sponsors that we want to call out right now are TSYS Global Payments, AFLAC, the W.C. Bradley Companies, Georgia Power, Liberty Utilities, Piedmont Columbus Regional, Emory St. Francis Healthcare, and Pzold. If there's any pandemic partner that we have missed or left out, we do apologize. Please let us know. We'll make it right. But we want to thank all of you for your support. Just a note of housekeeping. If you have questions, please put those in the Q&A, and we will work through those as best we can. We have some questions that we got before the call, and we will start with those. But before we start with the first panelist, we're going to do a brief introduction of Ryan Loke from the governor's office.
There we go. All right. Yep. Listen, first of all, I wanted to thank everybody. First, I just want to thank everybody for the time today and our distinguished guests. And Gerald mentioned we've got Ryan Loke, who has been instrumental in the health policy formation and legislation these past two legislative sessions for the governor, and has been here for the COVID response, implementation, coordinating with the operations, state response. And so we're just really pleased to have him with us. Just as the first of this year, Ryan was voted to the Deputy Chief Operating Officer, and we're proud of him and glad to have him with us, and glad that he's a part of the governor's team. He's a real expert in health policy and is a servant, public servant, and we're just glad to have him. And other comments, Ryan, thank you for being on our panel today and sharing what's going on.
Great, and thanks, Bill, and thanks, Gerald, and everybody for having me on this afternoon. As Bill said, I'm Ryan Loke. I'm the Deputy Chief Operating Officer for Governor Kemp, and I've had the honor of serving on his team for the past coming up on 2.5 years now, primarily in a health policy role, but really over the course of the last 12 months have been primarily focused on COVID-19, and have gotten to see every angle and be a part of every single bit of the state's response to COVID-19. And I can't wait to write a book about it one day, but it's been an incredible learning experience so far. I've gotten to be staffed out with our emergency management agency, our team at the National Guard, our team at public health a couple times, our team at community health, and then got to go and help set up the War Congress Center Alternative Care Facility now 3 times over the last 12 months. So I've really truly gotten to see all sides of the COVID pandemic, and have learned a lot and been honored to be a part of the governor's response in this effort. Have really gotten to know a lot of incredible people throughout this as well. Certainly Scott and Melody and their teams down at the hospitals there have been incredible partners, and have gotten to work closely with them on standing up testing sites very early on, making sure they had staffing support over the course of the summer through the fall, and now working with everybody across the state to ramp up in earnest our mass vaccination efforts. And that's really what I want to talk about a little bit today. But before I dive into vaccine specifics, I wanted to give you a quick update on where we are statewide with COVID. We are seeing really strong improvement across most of our metrics. Our hospitalizations as of this afternoon are standing at about 3,800 confirmed inpatients across the state. That's about the peak of where we were this summer, but it's down about 2,000 inpatients over the course of the last 3 or 4 weeks or so. So we are seeing improvement there, and hospital beds are getting freed up. Our cases have declined. Our 7-day average of cases is down about where it was pre-Thanksgiving, which is what we like to see. Our percent positivity of tests coming in has started to decline as well. The only lagging indicator that hasn't shaken yet off of a peak is deaths. And we know that is a lagging indicator. It's incredibly unfortunate. And we're monitoring that closely to make sure that we're getting hospitals and nursing homes and providers across the state the resources that they need. But really, really encouraged about the vaccine progress that we've made to date. And hopefully with these improved metrics and kind of the lull that we're seeing with COVID right now, we're going to be able to really ram home, getting vaccines in arms as quickly and as safely as we can. Before we hopped on, was talking to Gerald and Scott a little bit about the variants and what we're seeing right now in Georgia. We have 23 confirmed cases of the UK variant B117. Those are all primarily occurring in metro Atlanta counties. None of them, at least to my understanding, have been linked to any travel. So that means we know that the variant is here, the variant is spreading. Thankfully, so far, it doesn't appear that it is any more deadly or any more severe from a disease standpoint, but it does seem that it is more easily transmissible. And so we've got to make sure that we're following the 4 things that the governor and Dr. Toomey and their teams have really hammered home throughout the course of this pandemic. Washing your hands, wearing a mask, social distancing, and following the guidance that DPH and the CDC and others are putting out. We don't have any of the other variants that some other states have reported, whether that be the South African variant B135 or the Brazilian variant P1. Those have been confirmed in other states across the country, but nothing so far in Georgia yet. We are doing genomic sequencing testing randomly to identify that these variants are occurring, and that's how we've been able to pick up the 23 that have been confirmed so far. We're actively keeping an eye on that. Certainly, it's a little nervous, but viruses mutate all the time. And it just happens to be that the ones that are currently out there are more transmissible. So again, reinforces that message of the 4 key points that we've been talking about throughout the course of this pandemic. Really wanted to talk today briefly about vaccine administration and vaccine rollout and where we are. As of about 6 p.m. last night, we had administered a little less than 1.1 million vaccine doses. That's both Pfizer and Moderna. And that's about 70% of total doses that have been shipped to the state of Georgia that have been put in arms and been registered in our immunization tracking system that's called GRITS. Our weekly allocation of vaccine doses has started to slightly increase. We started to hear from the new administration in Washington and their partners on the manufacturing side that they've been able to identify some manufacturing efficiencies that have allowed slight increases over the last 2 weeks to occur, especially on the Moderna side, to our weekly allocation. Our new number starting next week of total first doses that are coming into the state is a little north of 154,000 doses. That's both Pfizer and Moderna combined. And that's a 21.5% increase over where it was about 2 weeks ago. And so we're making a little bit of progress, but it's still not, the 6 or 7 million doses that we need to be able to, really make a dent and achieve herd immunity as quickly as we can. We think that in order for us to get to about 80% of Georgia's adult population, we need to vaccinate about 6.13 million people to get to that 80% figure. So if you think, most of those vaccine administrations are going to be 2 doses, you've got to double that. That's 12 to 13 vaccines that we need in order to be able to accomplish that goal. So far, we've been allocated about 1.5 million vaccinations. And like I said, we've administered a little less than 1.1 million as of about 6 o'clock last night. We've made truly tremendous progress, in my opinion, over the course of the last 5 weeks or so. Early December, when vaccines were getting started and rolled out, it was a clunky process, and I'll be the first person to admit that. I think it was clunky across the country. Providers, were ready and excited to administer the vaccine, but the back end infrastructure and the IT systems needed from both a public health standpoint in the state and then certainly across the country, whether that was scheduling or reporting or tracking and shipping, so on and so forth, weren't necessarily robust enough at the beginning of the pandemic to be able to handle the demand that we saw, in early December. But we've worked through most of those issues and have really made some incredible progress. In early January, the governor and I stood in a press conference, and we were last in the country in the number of doses that had been put into people's arms. Behind all of our neighboring states and behind some territories as well, which was really disappointing. We were able to identify a lot of that was attributable to data reporting issues on our side, and then on the provider side as well. We worked closely with providers and large hospital systems and public health departments to clean that up. We made a lot of quick progress in that effort. But we also realized very quickly that there was a significant amount of vaccine hesitancy that was occurring in the healthcare worker population, ironically enough. The first prioritization populations that we outlined for our vaccine administration were in line with what the CDC and others had outlined for us. That was healthcare workers, and then patients and residents and staff in long-term care facilities. We were seeing some pretty good demand and take-up rate amongst healthcare workers not in long-term care facilities. Anecdotally, it was about 50% to begin with, which was good. But when you really looked at our long-term care facilities and nursing homes and assisted living and personal care, the demand amongst the residents and the patients of those facilities was anywhere north of 75 to 80%, which was fantastic. But the staff that were working in the facilities, that were the ones that were bringing virus from the community into the facility and causing such terror and torment inside the facility, the take-up rate was like 30%. And so we knew at that time, that was late December, that we really needed to make a quick change and expand the number of folks that were eligible to get vaccines. So we didn't have vaccines sitting in freezers waiting for folks inside of facilities to get comfortable to take vaccine. We were pretty ahead of most other states when we made that decision. I think we were 11 days before the CDC made a similar announcement to move in that direction. And we ultimately expanded our eligible population into what we called phase 1A plus. And phase 1A plus includes the previously eligible folks of healthcare workers and long-term care facility residents and staff. But we also added in there first responders, post-certified and federal law enforcement officers, and then seniors who are 65 plus without need for an underlying health condition. We know that the true purpose of vaccines is to prevent severe disease, hospitalization, and death. And if you go and look at our data and certainly everybody else's data across the country and across the globe, we know that as age increases, severe outcomes from virus, death, hospitalization, so on and so forth, consequently increase with that. And so we made the decision to get our seniors vaccinated, as quickly as we could. And as of about 6 p.m. last night, we had vaccinated 511,000 seniors had gotten their first dose, and a little less than 50,000 had completed both series of that vaccine with the booster since January 11th. We know we've got a lot of progress that we still need to make in this effort, but over the course of the last 4 weeks, like I said, we've made some tremendous progress, and I'm proud of what we've done. That total population of folks that are eligible right now in that 1A plus category is about 2 million people total, and about 1.4 million of that is seniors who are 65 plus. And the demand that we're seeing, and I'm sure you guys are seeing it down in the community there as well, seniors the number that we're hearing is anywhere from 75 to 85% want to take the vaccine, which is great. But it really puts us in a unique supply and demand problem that I didn't think I would have to address again after taking Econ 101 my freshman year of college. Like I said earlier, we're allocated about 154,000 doses a week for first doses, and then we get an allotment of second doses as well. That 154,000 is being prioritized to hospitals and public health departments and pharmacies and community providers who are getting vaccine in arms as quickly as possible and as safely as possible, and then reporting that data back into the state. We are not sitting on any doses on the state side. There's not a state stockpile of hundreds of thousands of vaccines sitting there waiting to be deployed. Every Friday we submit an order of vaccines, and on Monday it arrives and goes directly to providers across the state. And so far we've got more than 2,200 enrolled providers, I believe, and a little more than half of those have received vaccine. The most common question that I'm getting right now is, Ryan, what's next, and who's going to be next, and when do you think that's going to happen? We're cautiously optimistic right now about the news about Johnson & Johnson and their one-dose vaccine. From a logistics and operational management standpoint, having to only schedule one dose at a time is absolutely incredible. It makes this thing super easy. You don't have to keep it at an ultra cold or a cold storage like you do with the Pfizer and Moderna candidates right now. You can go out and deploy it quickly and get more and just keep going. You don't have to do follow-up, so on and so forth down the line. It's one appointment, one dose. And we're anxiously awaiting, I think, like every other state and health department is, for that to arrive. J&J submitted their application for emergency use authorization late last night. The FDA committee has said that they're going to meet to review the data on February 26th. And so really anytime after that, ideally, first week of March, we're going to start seeing Johnson & Johnson's one-dose vaccine start flowing into the state. We know that at the beginning, just like with Pfizer and Moderna, it's going to be a very limited allotment to the state. But with the commitments that Operation Warp Speed and the previous administration made, and that the Biden administration and their new team have continued, we know that over time that vaccine supply will increase. But kind of getting back to the base question of what's next, when's next, and who is going to be in that next category. We're in active discussions right now with DPH and our partners and CDC and some other folks to really identify what makes the most sense from a risk standpoint, what makes the most sense from a number standpoint, how do we get it, so on and so forth down the line. We believe that our next group of eligible Georgians that are going to be able to get vaccine is going to include educators, both at the K-12 level, and then certainly birth to 5, and then the child care level as well, and folks that are associated in the education system. And we're also right now in discussions with the Department of Behavioral Health and Developmental Disabilities about some uniquely complex populations that they serve that are acutely at risk from COVID if they were to catch it, to add them into the eligible population as well. We think that's about 500,000, maybe 600,000 Georgians at most. And then from there, we're going to look into adding more categories in of who that might be. And I wish I could tell you today who that's going to be or when that's going to be. My hope is that by the time J&J's vaccine starts rolling, that we're going to be able to start adding in more populations to our eligible groups across the state. But we really don't have any insight from a federal perspective or on the manufacturing side outside of a 2 to 3 week window, what our allocations are going to be in March. And so it makes it pretty difficult for the state to plan. And we're in the same position that every other state is, unfortunately, and we can't really see, what's coming down the pipeline. We know that they've committed 100 million doses by the end of the quarter. We know that Johnson & Johnson is coming, but we don't know when or how much the state is going to get. The last thing that I'll mention about our next population, and then, Gerald, Bill, I'm happy to take some questions if there are any, is we're trying to decide right now, what makes the most sense from a vaccine risk standpoint and operationally and logistically, how we really manage this. There's been a lot of conversation about the essential workforce and, do they come next? There's been conversations about folks who are, at severe risk, but not as high risk as seniors. Or the medically fragile being added to that category. There's been conversations about stratifying it by age and dropping it down to folks who are, above 50 or above 55. All of those conversations are ongoing, and I expect sometime in the next 10 days to 2 weeks that we're going to announce what our next prioritization is going to be, likely educators and that DBHTD group, but then after that as well, how we go forth and operationalize that. But it's a conversation like this that I have with folks probably 5 or 6 times a day of who's next, when's next, and how can I get it. So stay tuned on that and hope for an announcement soon. But kind of moral of my comments this afternoon, and I'll take some questions here if there are any, is Georgia is making tremendous progress in our vaccine rollout. Vaccine rollouts are clunky. Healthcare technology systems are very clunky to work with. Scheduling, it's difficult, and everybody wants to get a vaccine right now that we're hearing from, and that's great. We know that there's still going to be some vaccine hesitancy, and long term we're going to have to find a way to address that. We're limited on supply right now, but we're doing everything we can as a state to get as much vaccine out as quickly as we can and into people's arms as safely as we can, so we can hopefully put this pandemic behind us in the very near future. So thank you guys for having me on today. And Gerald, if there are questions, I'm happy to take a few.
Yeah, Ryan, thank you again so much for that overview. It's absolutely helpful. It's certainly informative. I do have a few questions. One of the questions is, are utilities still included in phase 1B?
So in the initial proposal that the Advisory Committee on Immunization Practices, ACIP, put out, they included members of the essential workforce and divided it in two between 1B and 1C. There was frontline essential workers, and then there was everybody else who is an essential worker. And I can't remember off the top of my head where utilities fell into that category, but I do know that utilities are an essential worker. But like my comments a few moments ago, we don't yet know what our 1B total population is going to look like, because we don't yet know what our allocation is going to look like, if that's a fair answer.
Okay, excellent. And thank you for that. So the next question is there a special way that large companies or large groups should be handling registration for the vaccine?
Sure. So we're looking into how we streamline that right now. My advice for large companies and the folks that I've talked to is, for your 65 plus folks who are already eligible, connect them with resources, either through the hospitals down there, through the public health department, to make sure that they go ahead and get vaccinated, because they are eligible right now. They don't have to wait for their employer to be eligible for them to be eligible, and encouraging them to do that. And then secondly, go ahead and survey your workforce and figure out who actually wants to get a vaccine. We've got, some very large employers in Georgia in excess of, 10, 20,000 employees, but, not every single person is going to want to get a vaccine. Not every single person is going to want to be the first in line of that company to get a vaccine. So figure out how many folks, in your workforce actually want to be, quote unquote, first in line to get a vaccine once it becomes available. And I think that will help from a planning purposes, certainly from y'all's perspective, and then ours as well. One of the things that we're working through, specific to your question, is how we streamline and implement what's called a closed pod enrollment. And so I'll take, Kia, for example, because that's just the one I know off the top of my head. Kia could potentially enroll as Kia Manufacturing and Kia Motors as an enrolled and eligible provider under what's called a closed point of distribution, where Kia would get its own allocation of vaccine straight, from our state allocation down to them. They would administer it themselves. They'd have the, liability and requirements on them to report into the data system and so on and so forth. But really working through right now the technical aspects of how we streamline that. Nobody really ever envisioned that we'd be in the midst of a global pandemic, kind of where we are right now. And so the planning that went into this was more focused on, an influenza outbreak and mass vaccination for an influenza shot, which is a hell of a lot easier to handle than a COVID shot that's got 2 doses and has to be stored and reported and so on and so forth. So, more details to come on closed pod enrollment, but for now, get your 65 plus vaccinated because they are eligible, and survey your workforce to see how many people actually want to get vaccine.
Excellent. And just as a little expansion on that,
Sure.
and I think you answered this, but it's, should employees included in 1B go ahead and register now? And I think your answer to that was that they don't have to register as a part of the company. They can go ahead and start getting into the pipeline on their own.
Yep. If they're eligible as part of the population right now, that 65 plus group, they can go ahead and knock that out. We have seen some health departments and some providers do kind of a pre-registration, if you will. That would allow them to go ahead and put their vital information and their PHI into a system. And when they're eligible, the provider would contact them and schedule that. That's not available totally statewide yet. We're working on something kind of behind the scenes right now to roll something like that out. But if you've got folks who are 65 plus, absolutely go ahead and get them vaccinated right now.
Yep, absolutely. The next question, Ryan, is it says the CDC has said that they're looking at the J&J shot and giving it to people under 65 years of age that have lower risk and holding the others for people over 65 and high risk. Is Georgia looking into this?
So yes, we are in active conversations with the CDC and folks. I've got an every Tuesday call with the CDC and with NIH and FDA and the White House and DOD and everybody and their mother on the federal government side who's handling this. And that was part of the conversation that came up earlier this week is J&J's vaccine is less efficacious than the Moderna and the Pfizer vaccine. I believe it's about 60 to 70%, where the Moderna and the Pfizer are 90 to 95%. But you can't really compare apples to apples, the Moderna and the Pfizer and the J&J vaccine. The Moderna and Pfizer are mRNA-based vaccines, and then the J&J, and I can't even pronounce the word, it's a adenovector, it's a different technology for vaccine deployment. But we are looking right now at what makes the most sense to deploy J&J and how quickly we can do that in an efficacious and safe manner. But more to come once the FDA kind of makes their move on authorizing the vaccine, if that's fair.
Excellent. And one more. There are two more, and then we'll let you go. We really appreciate you being with us. Of those who have been vaccinated, are you seeing any adverse reactions to the vaccine? And if so, what type of symptoms are most common when there's an adverse reaction?
So you can actually go and look across the country right now at all adverse reactions that have been reported. There's a federal system called VAERS, Vaccine Adverse Event Reporting System, VAERS. And anytime there's an adverse reaction that's reported, it gets pinged into VAERS and they go and they do some follow-up on it. Clinicians, when they administer the vaccine to a patient, have to monitor that patient for 15 minutes after the fact to make sure that there's not an immediate adverse reaction. In terms of kind of the immediate adverse reactions, and this is probably a question when Scott and Melody speak that they could probably better address than I could. We haven't seen a whole lot of folks who have had kind of the anaphylaxis, if you will, the immediate allergic reaction to it. It's maybe been a handful across the state. In terms of first dose symptoms, it's very similar to a flu shot. You've got probably a headache, a little bit of fatigue, a little bit of muscle soreness for a day or so. The second dose symptoms are a little more, I don't want to say aggressive or intense, but greater in quantity than the first dose in most cases. You are seeing folks who are reporting, almost flu-like symptoms of, fever and severe muscle ache and severe fatigue and being down for a day or so. It really just depends on the person, but those are the most common symptoms. And if you're really curious about adverse reactions, I'd encourage you to go look at VAERS and see what they're reporting.
Thank you. And the last question that we're going to have time for Ryan to answer is, given the size of the state, are there strategies being considered for the rural and underserved counties once more federal dollars become available? They clearly are lacking some of the infrastructure that's required to efficiently get this out.
Yep. It's absolutely spot on. One of the beauties of Georgia's public health system, and there's not a whole lot of them beauties wise, but we do have 159 county health departments. So we do know at least that there is some level of provider infrastructure that DPH can tap into in every single county. One of the things that we're planning for right now on the rural side especially is building out our mass vaccination efforts in communities where there's not a whole lot of supply right now, and being able to deploy, either for a fixed period of time or permanently, mass vaccination sites in areas that aren't necessarily covered up by large health systems or, highly staffed or highly employed public health departments right now. We hope to be able to announce more on that in the next 2 weeks or so. But we are making that effort to look at mass vaccination sites to make sure that everybody has access within a reasonable distance of their home to a vaccine, either at a county health department, enrolled provider, or a state-run mass vaccination site. On the underserved communities piece, we do know that there is, significant vaccine hesitancy, particularly among African Americans and Hispanics. We did a first pass at our race and ethnicity data over the weekend just to kind of see where we were, and we've got a long way to go. We got a lot of work to do, and unfortunately, there's history tied to vaccine hesitancy amongst those populations, and so we're really trying to work now with community-based partners and public health and the Morehouse School of Medicine and John King, who's our insurance commissioner, who was born in Mexico, and really deploying, community partners and advocates as best as we can into the community to make sure that we're addressing questions about vaccine hesitancy, about how to get vaccine. Do I have to have an ID? Do I have to be a citizen? So on and so forth down the line. And so we're working in earnest with Dr. Toomey and her team to make sure that we are addressing, kind of the least among us, if you will, and make sure that everybody has access to vaccine.
Excellent. Ryan, we can't thank you enough for your time this afternoon. The Columbus Chamber considers you a friend. You're a friend of Columbus, generally speaking. We know that you have a tough job. If we can be helpful and a part of the platform for getting the word out going forward, please let us know. We're happy to support in any way possible. We appreciate your partnership. Thank you.
Yep. Thank you, guys. And thank you, everybody.
And now we're going to have some comments and update from someone that we all know. It is the Honorable Skip Henderson. He's a great partner to us here at the Chamber, and we really appreciate his leadership over at City Hall. And Skip, with that, the floor is yours.
Gerald, thank you. First of all, just want to say thanks to you and the Chamber for hosting these virtual get-togethers, because I think it allows us to all kind of stay in touch a little bit. I think Ryan's gone, but I certainly appreciate his efforts at the state level in advising the governor on what we need to be doing. I will tell you that from our perspective, from the very beginning of this pandemic, we have focused on two things. One is partnerships. And the other was we were committed to doing our best to stay in front of this thing. In other words, don't react. I heard a quote early on in this thing where if the decision is easy, then you've waited too long. So we have sort of tried to live by that credo. We've caught a little heat for it from time to time, but we've always done what we think was in the best interest of our community. We recognized early on that this is a medical emergency that can have some serious financial implications to our business community. And we have not done a single thing without being mindful of that. We stood up a medical response team with our partners, two of which are on the presentation today on the panel. But we got everybody involved early and tried to peek around corners, as it were, and dusted off our crystal ball and see what was going on. Our office has been watching numbers every day. Richard Bishop in my office, he sits in there like some mad statistician, and he's pulling all these things together for us. Does a great job of it. But we've watched the daily numbers, but we've really focused on trends. We've looked at kind of monitored the monthly and the quarterly trends of this thing. And as we were talking about before we even kind of went live, it is comforting to see some of the numbers a little bit better, but you have to put them in context. For example, our hospitals, and you're going to hear from Scott and Melody, and they've done a heroic job. I mean, they've become so efficient and effective at handling the symptoms of this pandemic that it's been able to get people back at home, kind of convalescing at home fairly quickly. But even though our numbers are from a hospitalization standpoint, which they'll touch on, when we look at the composite that looks at all of the COVID patients in all of our hospitals, it looks better until you stop and think that it's still pretty close to where we were at our peak in July after the 4th of July holiday. So we continue to watch it, and we continue to be very careful and let those numbers drive our decisions. And I got to give credit to the folks in this community too, because the private sector has stepped up, and just the average citizen has done their part. And for the most part, they have done what the CDC has recommended, socially distancing themselves from one another, limiting the number of folks in any gathering, keeping a mask on if you can't stay 6 feet away, all the stuff that we've had drilled into us nonstop. We've tried to take that same attitude into the availability of the vaccine. I think a lot of folks seem to have forgotten that when we talked about this, when they talked about it at the national level, back during the late summer and fall, when we were anticipating a vaccine, they said then that we would hopefully, wasn't likely, but we would hopefully see it before the end of the year, but it would probably not be widely available until the March, April, May timeframe, sometime in late spring, early summer. And I think we're still on that path. That's a non-medical perspective of it. But as it became available, people became anxious about trying to line up to try to get the vaccine. And we certainly understand. But our hospitals and the health department have been incredible partners. We've also partnered, as I said, with the private sector. And we as a government are trying to stay in our lane. I'm not a medical expert. I leave that to Scott and Melody and Beverly Townsend at the health department. But what we are pretty good at is logistics and putting together processes and trying to help to distribute the vaccine. Our emergency management folks, Chief Scarpa, who is our fire and EMS chief, and our deputy director of emergency management, Chance Corbett, worked with the hospitals and with DPH and kind of pulled best practices together to put together a template that we've got a lot of confidence in at this point. Now, it's going to be a work in progress, but we've had an opportunity on 2 occasions to stand up that drive-through clinic for 320 vaccinations on a Saturday. And we came back the following Friday and were able to administer about 500 vaccinations. We honestly feel like we could conservatively vaccinate up to 5,000 people in a day using that system. It's been very efficient. And we've had so many great partners, obviously the hospitals and DPH, but we've also had Columbus State University step up. Their nursing students have been monitoring the parking lot that we have utilized for folks to sit and wait their 15 minutes. And that way these nursing students can kind of watch out for any alarming reactions. The CSU event staff has put up the tents for the drive-through. Our civic center staff, our sheriff's department, our CPD, they've all been involved in traffic management. And right now, everything's being done by appointment because the vaccine is coming in still, as you heard Ryan say, at a fairly slow pace. But when it does become more available, we envision using the civic center parking lot for some of the drive-through events. And I'll tell you, we've got some challenges that we're aware of or we're trying to anticipate, and we're working very hard on. One, of course, we can't do a whole lot about, but it is a challenge, and that's the limited availability right now for vaccinations. But another issue that we face, and we're going to continue to face, is and they're two, but they're kind of together. One is the intake process, allowing people to get in line, so to speak, and the other is in managing the information. For example, right now, there's about 35,000 people on a waiting list for the Department of Public Health's website. I may get this wrong. I'm not sure that they've received more than 3,500 doses as of yet. So people get on that website and they enroll, and then they don't hear anything, and they start to panic and they get anxious. And the fact is that they will be contacted for an appointment, but it's not likely to be until sometime in the spring. But we have had, as Ryan pointed out, we've got about 28,000 people, according to the census, who are 65 years of age and older. We have, with the healthcare professionals, with our first responders, with our law enforcement personnel, we're probably looking at around 35,000. That's an estimate that are eligible in Tier 1A. And we've put so far about 15,000 doses in arms. We've received about 22,000. And the only real reason for that disparity is some of those doses have been designated as the second dose for people who need to come back and get that second round of shots. So we're doing a really good job. I think all the partners together are doing a good job of getting the vaccine in the arms as soon as we can. But the challenge is just, as I said, is trying to receive enough vaccine so that we can vaccinate those that want it. We understand that another challenge is, and you touched on it in some of the rural areas where we face the same challenge to some degree here in Columbus, and that is reaching individuals in sort of our underserved community. People below the poverty level, people that aren't comfortable or don't know how or don't have access to register through an online portal. We have to have a way to reach these folks. So to that end, we've been looking at and talking to a couple of call centers here in our area who have been awesome. They've offered to operate at cost and give us a couple of folks. So now we'll have to pay the base rate, but it's going to be well worth that in order to be able to reach some of the individuals that won't otherwise be able to schedule an appointment. We also recognize that as we go forward, we're going to have at least a couple, probably several, walk-up only vaccination events, because we're going to have to be able to allow folks who could not get to some type of registration portal or even go in person to register because of transportation issues. So we want to make sure that we're providing opportunities for those individuals as well. So we've been strategizing, and we've sort of reached out to some of the faith leaders in our community, and we've looked at other influencers within some of these micro communities that are throughout Columbus, Georgia. Because our commitment is that we're going to do everything we can, humanly possible, to try to make it available and to try to get it in the arms of anybody that wants it. So I think the bottom line for Columbus is that we've once again relied on such strong partnerships, and they've come through again. It's not going to happen quickly, but we have a process established and in place that we believe is going to allow us, once it starts coming in greater quantities, we're going to be able to get it distributed very, very quickly. Other than that, I'll be glad to answer any questions that I can.
Thank you so much for that, Mayor. That perspective on what's happening at a local level is certainly helpful. There is one question that I do have for you, and I think you answered it, but just to confirm for the person that asked it, and it's the person is diabetic, and they just want to be sure that they can count on proactive communication from the Muskogee County Health Department to reach out to them when it's their time to get the vaccine. Again, it sounds like they just want to make sure that they don't need to do anything else other than registering on the site, which they've done.
Right. And according to the health department, if you have registered once, you should be receiving an email blast that they're now putting out once a week. Just kind of a reassurance reminder that, yes, they've received your registration. In addition to that, when we stand up the call centers, they'll be for intake where they schedule appointments for individuals, but there'll also be some efforts underway to allow them to proactively reach out to people that are on the list and answer questions, let them know that they're still on there, and confirm an appointment. So, and we're currently using just about every media source we can think of. We have been doing a 15-minute update online on Facebook Live every Monday, but we've also been sending it out to our electronic media, our print media, been on radio stations. We've been talking again to pastors, asking them to update people from the pulpit when they're having their sermon or their services on Sunday. So we're committed to using every tool that we can get our hands on to try to make sure that folks are aware of what's going on.
Excellent. Skip, that's the only question that I had for you from the audience. Any closing comments? And have you picked a team for the Super Bowl?
You know, I'm struggling with the Super Bowl. When my dad was an instructor when he was in the military at the Command General Staff College, I became a Chiefs fan as a kid. But I got to tell you, even though I've never been a Brady fan, I'd really like to see him do it with a team coming out of left field.
There
That's
you go.
my sports statement for the day. But I will leave you with this. This community has done an outstanding job. Our numbers have fared better from the beginning, both from a medical standpoint and thankfully, a lot of it due to your leadership, from a financial aspect as well. We've fared better than almost every community our size in Georgia. And it's because of the folks that live here. So what I would urge them to do, and this sounds so trite, but please just be patient. The vaccine's coming and it's going to be made available, and anybody that wants it will be able to take it. And the other part about that is it's a personal choice. I have not taken it yet, but that's frankly, it's because I didn't feel comfortable taking a dose when some 84-year-old that has underlying conditions couldn't get one. And we get those emails and those calls in my office every day. So I'm arrogant enough to think when 1B rolls around, I'm going to call myself an essential personnel, but I think it's a personal choice. I do think that the more folks that take it, obviously it's going to help develop a broad immunity, and we're encouraging them to do their due diligence, but then go get the shot.
Absolutely. Well, thank you so much again. We really appreciate your time this afternoon. We appreciate your leadership. From the chamber, if there are any other things we can do to leverage our supporters and platform to get more information out, we're happy to do that.
We'll do that. Thank you. I appreciate it, Gerald.
And now what we're going to do is we're going to have our community's foremost experts, because we're seeing this day in and day out. And we're working with the other heroes in the community to make sure that our community is taken care of from a health standpoint. And that's Scott Hill and Melody Trimble. I'm going to start with Scott Hill and get an update about the activities and information from Piedmont Columbus Regional. Scott, it's good to see you.
Good to see you too, Gerald. I hope you can hear me okay.
Absolutely.
Just wanted to, give a quick update for Piedmont Columbus Regional and also the Region I. Piedmont Columbus Regional is a regional coordinating hospital for the state of Georgia within their disaster emergency management infrastructure. So I'll try to touch on kind of all phases of that. Right now within our organization, both Piedmont Midtown and Piedmont Northside, we are starting to see a fairly I would say steady but slow decline in the number of inpatient hospital admissions. Our peak that we experienced about 10 days ago, was drastically higher than what we experienced in July, which was drastically higher than what we experienced back in April. And so it's been really amazing to watch the resiliency of the healthcare workforce be able to deal with each one of these surges. And when we thought this one was worse than the last one, the next one's even worse. And honestly, it's been a challenge, no doubt, for our workforce. We just have amazing, and I will say this, representatively, and I know Melody is certainly very proud of her workforce, just as I am. We've got warriors working in these hospitals. People need to know that. They are working hard. They're very tired. They've been running a marathon for about close to 12 months now. And, in healthcare, typically there's a pretty frenetic pace, but it's quick. And, when there's an event, we treat it and it goes away. And then there's the next event and the next event. This has been one long event. And so the workforce is working really hard. A long time ago, we coined that term. It's a marathon, not a sprint. Well, it's an ultra marathon. It's not just a marathon. It's one of these 120-mile races that our staff is running right now. And I can't say enough about the clinicians, the people at the bedside, physicians, nurses, respiratory therapists, lab techs, rad techs, emergency room personnel. I can't name them all. How proud we should be of these folks and the way they're representing our entire community in Columbus. Our healthcare workforce is something we should all be proud of, and they're really coming through for us right now. So we have been focused not just on patient care during this latest surge. We're also been very focused on getting the vaccine rolled out. We currently, inside of Piedmont Columbus Regional right now, we have a number of things that we're doing to try to bring different therapies along with the vaccination to the general public. And so right now within this organization, we have given a little over 3,100 total vaccinations, first and second shots, to our workforce. And unfortunately, that doesn't represent as high a percentage as I would like for it to of our workforce. You heard Ryan talk about that. There are challenges with getting people to accept and want to take the vaccine, but we're really sifting through our data and working unit by unit within our organization to try to drive our vaccination rates up even higher. Along with our employee vaccinations, we've been able to also do a little over 2,700 shots for our 65 and older patient population here in the city of Columbus, patients that are affiliated either with a Piedmont employed or a Piedmont clinically integrated physician. We've been able to accommodate those. We had both our employee and our patient shot clinic happening in the conference center of Midtown Medical Center, and that has been a really nice, I think, effort to be able to not just reach our employee populations, but also our 65 plus populations. And then through Region I, you heard me mention that the Region I coordinating, we actually applied for and received provider status. And in the Region I clinic, we have delivered just over 5,000 total vaccinations to the general public and those folks that fit into the first phase of vaccination. And you know, I want to make clear to everybody, I think it's important. There are a number, there's a number of ways to get vaccines in the community right now, and it can be confusing, right? Because, I think folks are, I can go to Piedmont Midtown and get my vaccine, and then there's a clinic at Doctor's Hospital, and there's also the Department of Health. And I know Melody has things that they're doing also over at St. Francis. And so, I think what I would encourage people to do is follow Mayor Henderson's advice, and that's be patient. It is, you also heard Ryan Loke, say this is, unfortunately it's an economics kind of problem right now. It's supply and demand. There's tremendous demand for the vaccine, and that's a positive for everybody. But the supply, we need, they're working on getting more supply out. What I would tell you is in our clinics, particularly the Region I shot clinic, where we've done a little over 5,000 doses, we have the ability inside of that clinic to probably do about 3,500 patients a week. And so, should we be able to get more vaccine from the state, we'll continue to open that up in the phases that have been approved by the governor and continue to deliver vaccine to the general public along with Department of Public Health and the other mechanisms. I did also want to touch on, because I know there's been a lot of interest in the community about the fifth floor Doctor's Hospital. As everybody know, the Amos family gave us a wonderful gift to be able to have that prepared and ready for use should we need it for inpatient care. And while we're not doing inpatient care up there, we did start the monoclonal antibody therapy, the bamlanivimab drugs that require an infusion, and we're actually doing that on the fifth floor Doctor's Hospital in the old ICU. So we've set up an infusion clinic to bring the monoclonal antibody therapies to the patients that we serve. So far, we've done 343 of those patients, 200 and about 276 of those on the fifth floor. We actually do those infusions in our emergency room too, to prevent hospital admissions. So if we have a patient that meets the criteria, we'll do those in the emergency room and hopefully keep that patient from having to be admitted to the hospital, send them home, and then treat them as an outpatient on the fifth floor Doctor's Hospital. And then we also had a long-term care organization reach out to us to see if we could help them. They had a rash of an outbreak in their facility. We were able to go over and start doing the monoclonal antibody therapy inside of that long-term care facility, and we've treated about 47 patients inside of the nursing home in which they reside. So again, trying to keep people out of the hospital. But just wanted to, I guess, give everybody, as quick as I could, an update on kind of the activities around patient care and the amazing efforts of, the healthcare workers in the community, and then vaccination and some other things. So, Gerald, that's all I've got for today. Glad to answer any questions.
Thank you so much. I do have a question, but it is for both of you. So I'll ask Melody to do her review or overview first, and then we'll come back to that. Again, Melody Trimble, we have next. Certainly, last but not least, and she and her team are doing amazing work over at the Emory St. Francis campus as well. Campus as well. Melody, thank you so much for your partnership. And I want to thank both of you for being chamber board members. Again, we really appreciate you and what you do and what your teams are doing and the partnership. Melody, we'd love to hear the overview of what's going on from your perspective.
Well, I won't repeat a lot of what Scott said because we're doing very much the same things. We're very happy that we have the hope in the vaccine. Our goal is to get the shot in arms. We believe that will help combat this, keep our teams healthy. We're very, very fortunate. I have about 2,500 team members, and today I can say I have 9 people who have been impacted by COVID, and very few have gotten COVID, thankfully, on the hospital side. So it's very safe to get care here. And I think that's the thing Scott and I have continued to do and will continue to do, is ensure the public that it is safe and that they need to not delay the care that they get, because quite frankly, I think COVID's caused people to be a little more cautious, and we're seeing some of that. And I think as soon as we can start helping you through the COVID crisis, the better you are. I think the better your chances are to recover from that. Everything that he talked about, we also are partnering with long-term care facilities on the monoclonal antibody therapy. We are infusing that in our outpatient infusion center here as well. Again, as we can do that, we have limitations too. Just like Scott said, we have a staff. I'll just say the agency, I think, Scott, you've been impacted. I hear it throughout the state. We have tremendous, I think, concern as a state and as a institution of healthcare, the impact that agency and travel nursing has had, or travel with respiratory therapists and so on and so forth in our industry. We could open up more beds, we could provide more care, and we've done a great job here if we actually had more staff members. But when they're getting paid some, nurses making $180 an hour, we're losing them to some of those travel opportunities. So I think that's, if you ask me what keeps me up at night, is just making sure that we continue to have enough support wrapped around our team, because we've had our command center up, it's 330 days today. And the resilience that healthcare workers have, to what Scott said, we have that. But now I think it is that they're even having to dig deeper, finding joy in the work and supporting that team and looking at the small victories and celebrating with them. Because most of us that got in healthcare got in it to be very purpose driven. It was a calling for us, and it continues to be that. So I think it's very, very important looking at the mental health of our team, and that offering those wraparound services that continue to support them to continue the good fight, because we're not over it. But I will say what Scott said as well, and our mayor, that we're seeing a trend, and it's a trend that we're hopeful for. And I agree, what I saw in late March, early April, I thought was okay. Oh my goodness. And then here came June, July, and we actually thought, well, this is really bad. And then we saw what happened. And it's amazing. And maybe it was a journey, because I think the processes that we put in place prepared us. It just, the scale got bigger. And so I think we could rally quicker. I think the other thing that has helped tremendously, and every life that's lost, is just, there's not anyone, including me and probably Scott and everyone on this call, who hasn't had an impact of COVID in our lives. But we are so much better at recognizing and treating that the success of that has, and the treatment modalities have come along so well that I think we're seeing better outcomes. However, the surge brought on just more patients, more and more patients. So I'll say that as far as the vaccine goes, I think we are, in times of crisis, you're almost forced to be innovative because that's what you also do. And so there's a positive outcome. So I don't want to lose the lessons that we've learned during this. For our team, it's vaccine, 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 and continuing. What is the narrative, or what is going to be those words, or that speak to them to go, yes, it's okay to get this vaccine, because it was our doctors are very, very compliant. Our team members were less compliant in wanting to take the vaccine. And we're seeing that grow. We've gotten through the holidays. It was like a test of change. I've seen people get it. Now others are coming to the table. So we're very, very happy. We've vaccinated first and second, just at the hospital alone, about 2,100, of which about 900 have completed both vaccines. I'm also pleased for our patients in our Columbus clinic that we have with our partnership with Columbus Clinic. They have the Moderna, and they stood up within their clinic to give their patient population that meet the governor's mandate there about the age 65. So they started that. They've done their test of change. They're gearing that up. And so they'll be in full swing next week. So we'll see definitely more shots in the arms, as I call it, being vaccinating heroes that they are. And then our outpatient pharmacy, we've been working in a very controlled environment because it is on our hospital campus and it's not something that we do, but we don't want to leave any vaccine on the table. So we have done a great job the last 2 weeks. And I've worked with the Skip and the teams on can we do targeted to help our EMS and our firefighters and our other healthcare workers, so that we can get the 1A population as much as we can, so that we can keep our workers at our hospital going. So that's what we're doing right now. And we'll continue to do that as long as we have vaccine. And we are, just like Laura said, I think on all the calls we've had, as well as Scott, I think would confirm that as well. We are holding back that second shot because we want that efficacy of that 97%, so that our team stays healthy. But what else can I say? I'm just extremely proud of this team. I am humbled every day by the stories of courage and vulnerability and resilience that they speak, and I see it lived out. And I also want to say that this community and the partnerships, I think when I hear other stories, I'm so proud of Columbus, because it really was our Joseph at the well, if you will. Everybody joined together and said, we're going to get through this. And to me, that's very purpose calling. And that's what we're in here for. How do we help sustain and create a safe environment for you and I to reside as residents in Columbus? So I know we're short on time, and I do have a hard stop, so I've got to go too. But if there's any questions, I'll certainly take them.
Yeah, thank you so much for that. And we do have one question that we'd like for both of you to chime in on. And it's, can either of you give an overview of the medicines or treatments you're currently using to combat this in your patients? Knowing that a lot has changed since March, there's just curiosity around what's changed tactically. And it ends with thank you both for all that you do.
Scott, do you want to take that one? I know you're doing the same thing. One of us can answer, and it'll be the same things.
Yeah, it'll be pretty much the same thing. You're right, Melody. And I know you said you had a hard stop, but if you want to take it, go ahead. Or if you want me to, I will. It doesn't matter. Okay. So that
because they're waiting on me.
No, you go ahead. It's all good. I understand completely. So, really when you look at what's occurred since the early spring, and I'll keep this answer brief, the way the treatment of the disease state has changed over time, frankly, has become so much more efficient. We knew very little about the disease in the early spring months. And as we got into the treatment phases, we were able to learn more and more as the realities of the disease states kind of set in, if that makes sense. And so from that perspective, we've been able to look at different therapies. There are new drug therapies that are available. People have heard about the remdesivir drug. There are then now, that was early on. We're still using remdesivir today. We're still doing those treatments inside of our hospitals today. And now you're hearing a bit more about the monoclonal antibody therapies that are widely available inside of this community. But really, the big changes, I think, and it's almost kind of hard to find the right words to describe it, but the way that the bedside healthcare providers treat these patients. We've learned a lot about how to deliver medicines, the timing of certain medicines, how you can use combinations of therapies to keep patients from having to go on a vent, high flow oxygen therapy, traching patients who are on the vent. Sometimes they have a better outcome. There's a lot of different little things that we're learning at a very fast pace inside of the healthcare industry right now. And so the great thing is that when it comes to treating a pandemic, there's not competition. We share information because we want everybody to get the best care possible at every facility they go to. So there's new things coming out every day. And what I will tell you is, for the folks on this call, I've never seen a higher adaption rate, a faster adaption rate than you're seeing right now during this pandemic. I mean, something comes out, people are trying it, they're jumping on it, they're getting results, they're sharing the results. So that's a really good thing.
Good. Thank you so much, Scott. That is the last question. We've got one more. It's a comment, and it's from Audrey Hollingsworth. And it's many thanks to Scott, Melody, and their staffs for caring for us in the community. We appreciate your commitment through this pandemic. And those are certainly words that I would want to echo. We appreciate your partnership from the Chamber. We want to have a healthy community. We want to have a healthy economy. We know that the work that you guys do is heroic, and we want to support you in that in any way possible. I want to thank everyone, Skip. I want to thank Ryan Loke for joining us, and all of you who took time out of your Friday afternoons to get this important information. As we have other opportunities to distribute additional information related to this, we will leverage our platform to do that as best as we can. So again, we want to thank everybody. We want to remind you to social distance, keep your hands clean, wear masks, and enjoy the Super Bowl weekend. We hope to engage with you all soon. Thank you.